So my mom was a recovery room nurse, and she certainly was an influence on me, and she knew surgeons, so that was kind of her area of expertise. But there really were two sentinel events. When I was a 7th grader, I developed acute appendicitis. And my mom probably saved my life because I was sick as a dog, I was throwing up, I couldn't hold anything down, even water. And she thought, this is not right. So she took me down to the emergency room. They called the general surgeon in, and the general surgeon came up and pressed on me, poked on my abdomen, and said, I think you've got appendicitis. But what was really very special was he then said, I think I need to take you to the operating room and take out your appendix. Do I have your permission? He obviously had to get my parents' consent, but the fact that he asked me as a 13-year-old. So I felt so much better, right after surgery, after I recovered. And then the second event was I ended up becoming a nursing assistant and worked at the county hospital in Minneapolis. And I had started college, I was thinking about medical school, but I saw my friends out playing after, while I was in biology lab. So I thought, I don't want to do this. But then I started working as a nursing assistant. And I was working on a medical surgical floor. And so I was working around all the nurses, and I had these patients that I was helping to take care of. And all these surgical residents were coming through. And so they had different levels of training. And the funny thing was, I could just see what they were doing. I thought, that is really interesting. And there was one patient in particular who I think she had end-stage kidney disease. So her kidneys were failing, she was going to need a transplant. And just to talk with her and to see how they were taking care of her really influenced me. And at that point, I decided to go back and do my pre-medical requisites and then apply to medical school.